Hi, so today we're going to do some identifying of dental instruments. The first one we're going to do is our Explorer / measuring probe. So we'll see here, this part of the instrument here is the measuring probe, and what that does is measures the sulcus depth, which is basically the pocketing depth between the gingiva and the tooth root. It does have little notches on it for measuring, and they're by millimeters, so I can't get too close to it because my phone is not focusing very well, but there are 3 larger notches on that, and that indicates 3, 5, and 8 millimeters, and then there's small ones in between, 1, 2, 3, etc. So that is the measuring probe. On the other end here we have our it's our dental probe. So what this is used for is to basically examine the surface of the tooth. This sharp point there, it enhances the tactile sensation, and it helps to identify abnormalities in the tooth surface, like caries or possibly fractures or furcations. Right, very similar to the periodontal probe is the sickle scalar. And currently I can't find any of our sickle scalars. We have 3 in the hospital somewhere, but I cannot find any of them. This is very similar to the periodontal probe. It is much smaller though, so it has a fine point to it. And what we usually use this for is scaling small grooves in the teeth. So if we have like blood grooves on the canine teeth, this is what we would use to remove plaque and tartar from the tooth surface in those areas. All right, so our next instrument here, so here we go. So this instrument here is it's a subgingival curette. So what this is used for is removing plaque from the surface of the tooth root. So this is where we would go underneath the gum and scrape off the plaque from above the gingival line. So it has these little curved edges, and then this part here is flat. So we can kind of push the gingiva out of the way and then scrape it down towards the tip of the tooth. So that is what that one's used for. And there's 2 ends on this one. The next one is called a Jaquette scalar, or we also call it a supragingival. So basically, not under the gum, but this is used to scale plaque and tartar away from the surface of the tooth itself. So there's a couple different edges here. This one is more at a 90 degree. Oh, come on, there we go. And so it has that sharp edge on it, sharp flat edge, and that's gonna help to scrape the plaque from the tooth. This side here is just the same. All right, and I think that that is all of them. So yeah, thanks for listening.